So, good morning.
Good morning, Pam.
Today I'm talking with Dr. Ann Coleman, who is an adjunct professor at Providence College. She is an expert in adoption-related issues and a fee-for-service clinician at Adoption Rhode Island. She also maintains a private practice in Norwood, Massachusetts, and is a frequent presenter on adoption-related issues, and we're very lucky to have her here and here this morning talking with us. So thank you, Anne. I appreciate your time.
My pleasure.
And so can you tell me a little bit about what interests you about the adoption field, maybe from a personal and professional level?
Sure. Well, I think working in this field, and especially working here at Adoption Rhode Island, I have a real strong passion, both personally and professionally, for families that are formed through adoption. Personally, I'm an adult adopted person, and I have 2 children who are adopted internationally. So from that perspective, I have a strong sense of connection to the families that I work with. And professionally, I've been a clinician for over 20 years and have really worked with a multitude of families on a wide range of issues. And I think certainly the issues that the families that come to Adoption Rhode Island that they struggle with and that they need assistance with are issues that are profound and are really issues that deserve a lot of attention and deserve a lot of compassion. And I think everyone at the end of the day just wants to become a healthy and strong family, and that's something that I am really pleased to be able to work with families on.
That's awesome. And so can you tell me a little bit about some of the challenges that you've experienced in working with this specific population? Because I would imagine that there are some, there are unique challenges to every population that we ultimately decide to work with. And I know that why you've been drawn to this field, that's pretty obvious, but what are some of the challenges that you see with the kids and the families that stand out for you?
Well, I think that certainly one common theme that all families have that come to Adoption Rhode Island and who have been formed through adoption is really the theme of loss. And it's not just a loss for the child or for the adolescent, but I really believe that the loss is broad, and it's loss for the parents or parent as well as for the children. And although that loss seems to sometimes separate the families, it really can be quite a unifier because it's a powerful theme that they're all experiencing. They may be experiencing it on different levels, but yet they are experiencing it. And in addition to loss, I think that the issue of understanding the depth of how issues may impact children prior to coming into their forever family, and that they can have long-ranging effects, and they may kind of come in waves and come about at different times of the year or as a result of different triggers. But I think it can sometimes be confusing for parents because they want so much for their children to become a part of their family, and they want so much for their love to heal their children, and that sometimes the power of the traumas and the power of the environments that the children have been in prior to coming to their forever families takes a while to heal, and can take different forms of healing. And that's something that we here at Adoption Rhode Island really try to facilitate, is working together for that healing. But I think that sometimes can be a challenge, is that it might not happen on the same time frame that parents would like it to happen, or if it kind of subsides for a while, maybe rears its head in adolescence at different,
and it doesn't look like the way they expect it to look, right? They're like, they might be prepared for X, but they're not prepared for Y. Nobody told us about that.
Right. So I think helping to educate families that this isn't kind of just a one-stop quick fix, that it really is a process. And as I had mentioned earlier, as an adopted person myself, there are so many developmental phases in the life of all of us, adopted or not, but adoption adds another layer to issues that might arise in those developmental phases.
Exactly. You've talked about the challenges, and I would imagine there can be some rough days, some rough sessions that families have to go through. But maybe you could talk a little bit about what happens on a good day. What is a success for you, or what feels good, or why do you keep coming back from work? Because it's hard work. Sometimes I would imagine it's very difficult work to sit with some of that pain and sadness and struggle. So why do you do it, or what do you get out of it, or what's a good day for you?
Well, I think being in this position, whether here at Adoption Rhode Island or in my private practice, we're all witnessing and being allowed to be a part of the family's life. And by being that witness, we're helping them in moving forward. And those can be real baby steps, or those can be huge leaps. But for most of the time, being very realistic, they're baby steps. So I think that what is important to appreciate as a clinician in working with families is it is those little baby steps, and being able to really be aware of what those are and not be looking for those powerful, earth-shattering moments of, oh wow, it's really just sometimes it can be the look in a client's eye, it can be a smile that didn't exist the previous session, it could be, a teenager accepting your interpretation of a situation, it can be them just really allowing you to be present in their life. That's powerful. And in the class that I teach at Providence College, and teaching students who are going to be counselors, it's really about being present with your clients. And for these families who are formed through adoption because of all of the issues that they've lived through, both parents and child, before they come here, it's so important to honor and respect all of those paths that they've had to travel to get to this place. So for me, I'm so impressed that they're together as a family. So from then, everything else is a plus.
Yes, they're showing up.
They
want.
They may be kicking and screaming, and they may be having a hard time in between sessions, but they're here. And certainly maybe a 12-year-old or 15-year-old wouldn't be here and volunteering, oh, I want to come for therapy, but they're here and they really do the work. And that's very, very rewarding.
So Anne, I just wanted to thank you so much for being present with me this morning. We are so lucky to have you here, and so are the families, all the families that you work with, and I appreciate your taking the time this morning to talk with us.
Thank you very much, Pam.
Okay.